Hi everyone, welcome back. So today I am going to be talking about how massage can help with fibromyalgia and also chronic pain that's associated with the fibro. I'm doing this because I've come across quite a few people in my work who sort of mistakenly believe that, maybe they can't have massage if they have fibromyalgia, and, that it could somehow cause a flare-up. So I'm going to address this today, and I will also be talking about the fibromyalgia tender points and how they differ from trigger points. So I'm going to start by really talking about what fibromyalgia is. It's still kind of not completely understood. It's a condition that causes pain throughout the body, leading to sometimes chronic fatigue, sleeping problems, and various other issues. And so people that suffer with this tend to be more sensitive to pain than those without the condition. It's probably one of the most common chronic pain conditions in the world, affecting over 20,000 people per year just in the UK alone. And research has suggested several causative factors and risk factors that may increase a person's chance of developing the condition, but there's really not been sort of any conclusive cause of fibro. A lot of people with fibromyalgia often will find that they have a dual diagnosis, so they may have other conditions such as osteoarthritis, rheumatoid arthritis, lupus, hypothyroidism, and they might also have things like high blood pressure, be at risk of heart attacks, diabetes, depression, and other mental illnesses as well. So first things first, so what actually is the cause of fibromyalgia, or rather the suggested cause? Well, it's been suggested that abnormal pain signalling may be part of the problem, in that the nervous system perhaps doesn't process the pain signals in the usual way, and so this would then increase pain sensitivity, mainly due to abnormal levels of chemicals in the brain, the spinal cord, and the nerves, which then can lead to sort of overstimulation. Another suggestion is hormone imbalances. So the thinking is that relatively low levels of hormones such as your serotonin, your dopamine, your norepinephrine in the brain and nervous system may interrupt pain signals and therefore intensify sensitivity to pain. And this serotonin and the dopamine and norepinephrine, they're all hormones that help the body to process pain. And so that's why if they're relatively low, your sensitivity to pain may be affected. Now, another suggested cause is genetics. Certainly, we see that fibromyalgia can run in families, and it's suggested that this is probably due to some sort of unidentified genetic abnormality, which increases the risk, for the condition. Certain genes may, control how the body regulates pain responses, but scientists have sort of speculated that people with fibromyalgia carry one or possibly more genes that cause them to react strongly to stimuli, that another person without the fibro may not perceive as painful. So again, it's sort of to do with overstimulation, of those pain responses. There are also various triggers that have been linked to fibromyalgia. They're unlikely to cause the fibro themselves, but they may trigger the onset of fibromyalgia in people who perhaps are already at risk, by basically altering the nervous system's response to pain. So, these triggers could be anything such as repeated injuries or infections such as the flu, surgery, childbirth even, any kind of emotional, and also sort of, I suppose in surgery we've mentioned like physical trauma, but emotional trauma. So it could be anything like abuse, or something more simple like a breakup, or a bereavement. They have also been potentially linked with the onset of fibro symptoms. Sleep disturbances is another one. If someone has problems getting enough sleep or spending enough time in that deep stage of sleep, that seems to be quite common with fibromyalgia. But whether or not this is a cause of the fibro or a symptom remains unclear. And of course, abnormal sleep patterns, they can alter the levels of chemicals in our brain as well, which of course, could have an impact also. So there's various risk factors of fibromyalgia. Certainly gender appears to be one, with fibromyalgia being more common in women than men. We'd say women are 8 to 9 times more likely to develop fibromyalgia than men are. And scientists believe that women experience pain differently to men, partly due to their reproductive hormones, such as estrogen, which we know makes women more sensitive to pain, hence why pain levels fluctuate during a woman's menstrual cycle, which is when the estrogen levels rise and fall. Potentially also the menopause, which also results in a sudden drop in estrogen, could be another potential risk factor for fibromyalgia. Age is another one. Most people with fibromyalgia tend to be diagnosed usually sort of early to middle adulthood. I'd say sort of between around 20 and 50 years old. We mentioned genetics about a possible causative factor, and family history certainly increases the chance of developing fibromyalgia if you have a close family member yourself who already has the condition. Sleep disorders, we mentioned about sleeping, whether it was a symptom or a cause. Some people who have sleeping disorders, such as sleep apnea, restless leg syndrome, seem to be more likely to have, fibromyalgia as well. But again, there's no sort of definitive proof of this. Other rheumatic diseases will increase your chance of developing fibromyalgia. So rheumatic diseases affect the joints and muscles and bones. So we're talking things like rheumatoid arthritis, osteoarthritis, lupus, ankylosing spondylitis, all of these, sort of inflammatory or conditions that affect the body's response to pain. And depression. So depression, any mood disorders seem to be linked with fibromyalgia and higher incidence. Any mental health conditions such as depression, anxiety, they stem from the same chemical imbalance which has been linked to fibromyalgia. And the strain of living with chronic pain can also cause depression, and depression can make your pain worse. So again, there's a definite link there. Surgery, which we mentioned as a possible cause, and also exercise, whether that be too much or too little, has also been linked to fibromyalgia, and certainly linked to flare-ups of the symptoms also. So what are the symptoms of fibromyalgia? Okay, so symptoms of fibromyalgia, there are quite a few, and I've probably even missed a couple, I'm sure, off this list. But so starting with systemic problems, so certainly pain, usually a dull aching pain on both sides of the body and above and below the waist, possibly with like cold-like symptoms or flu-like symptoms. There may be a sensitivity to noise, light, temperature. Certainly sudden changes in temperature, hot or cold, will increase the likelihood of a flare-up. And there may also be some numbness or tingling in the hands and feet. Restless leg syndrome is quite common, particularly at night. And sometimes even weight gain may be an issue. For the eyes, there may be changes in vision noted. And also with the jaw, there can be some jaw pain or dysfunction of some sort. Quite often something like a clicking in the jaw may be common. Then looking at the more sort of central symptoms here, so that ranges from headaches, dizziness, and trouble remembering things, concentrating. Sometimes this will be referred to as fibro fog. There may be sort of signs of attention deficit, spatial disorientation, headaches, dizziness, cognitive impairment. Quite often there'll be trouble sleeping. We've mentioned about sleep disorders being linked to fibromyalgia, and also mental health issues such as depression and anxiety are also common. With regards to the skin, there may be more skin complaints, severe allergies, rashes and itching. Pain may also extend to the chest and heart palpitations. There's also an increased risk. In terms of muscular pain and joint pain, it can be noted that there is sort of increased stiffness in the morning when you wake up. Potentially, this is quite common, sort of to have a tight upper neck in the morning. But there may more generally be chronic fatigue, obviously myofascial pain, tender point pain, which we're going to go on to discuss in this video, which occurs around the soft tissues of the joint. And just generally that, twitching, sort of without any particular reason, can also be quite common. Going further down onto the stomach area, there can be a lot more nausea, diarrhea, abdominal pain, and irritable bowel syndrome is also sometimes linked with fibromyalgia. There may be problems even urinating, and also problems with the reproductive system in terms of dysmenorrhea or painful periods. So before I go on to talk about the tender points, I'm just going to briefly say how massage can help those suffering with fibromyalgia. So a massage for fibro sufferers would be a lighter massage, more like a Swedish. Deep tissue and sports really wouldn't be appropriate. And could in fact cause a flare-up. And I've seen other therapists make this mistake, which does result in that person being quite unwell. But Swedish, keep the pressure light, and there, shouldn't be a problem. So you would start the massage with sort of softer, more relaxing strokes, basically just to warm up the muscle, and then follow it up with slightly deeper frictions over any knots, just to try and relax those muscles and break down any, thickened fibres of connective tissue, release any toxins, and help reduce the pain. So in terms of massage, the main benefits really for fibro are, we know that massage increases the serotonin levels, which is that mood enhancing hormone. So that will help with any depression that's linked to the fibro, and just generally, improve the mood, which when you're suffering from chronic fatigue and pain, your mood can really suffer, even if you're not actually diagnosed with depression. Massage will also bring about a decreased production of cortisol and adrenaline, which are those stress hormones. So again, just helping you deal with the fibro and its symptoms better. And again, just enhancing the mood, reducing stress and anxiety. There's also been shown to be a reduced level of something called substance P through massage, which is one of your pain messengers. So if these levels are decreased, then potentially that can then reduce the sensitivity to pain, which again we know is sort of probably the biggest issue with fibro. Certainly decreased tender point pain. We know that massage helps with pain relief, and as I say, I'm going to go on in a minute to talk about the tender points. Massage, we know, helps improve sleep patterns. So again, for fibro sufferers, if they're having, chronic pain, possibly suffering from one of those sleep disorders such as sleep apnea or restless leg syndrome, which can again keep you awake at night. Hopefully massage will just help to promote a good sleeping pattern. And obviously in doing all these things that we've just mentioned, there's an overall improved sense of well-being and just more positive mood, and reduced likelihood of depression, which, as I've said, helps anyone with a chronic condition just deal with the symptoms a bit more, effectively. So, okay, so I'm now going to talk about the tender points in fibromyalgia, which are usually where the pain is felt. So, in this diagram, we can see all of these highlighted areas. And so these are the tender points in fibromyalgia, of which you can see there are 18. Now, these can be confused sometimes with trigger points in the muscles, and they will basically produce localized pain when pressed. Now, it's actually been suggested that these tender points, which are usually around the size of a penny, are due to some sort of hyperstimulation of the central nervous system. The tender points tend to be located in clusters around the neck, chest, shoulders, elbows, hips and knees, as we can see on this diagram. And they are located on both sides of the body, front and back. Now, in the past, diagnosis of fibromyalgia has been dependent on having at least 11 of those 18 tender points for 3 months or more, and that they had to be covering all 4 quadrants of the body. But one cause of fibromyalgia, previously having been left undiagnosed, is that people with fibromyalgia often have fluctuating pain levels. So, on the day they go to see the doctor, they might have only had a few, points of pain on that day. Hence, they wouldn't have, met the criteria. But now they've actually changed the diagnosis sort of criteria. So now they actually take into account other, factors such as cognitive symptoms, fatigue, sleeping patterns, and also they use a pain index. And this basically just gives a more accurate indication of fibromyalgia. And, also it's sort of the fact that these tender points are very similar to trigger points. This is also an issue because sometimes they don't get seen as tender points, or, fibro sufferers can also actually have a high incidence of trigger points as well. So the two, it is possible to confuse the two. So I'm just going to explain the difference between the fibromyalgia tender points and normal trigger points. So trigger points are like hard, knotty lumps that form in the muscle tissue, and they will cause both localized and referred pain. So, you could have a trigger point in your shoulder, but you could be getting pain in your arm. Trigger points and myofascial pain are very common in people with fibromyalgia, particularly around the neck and the shoulders. And in fact, in the neck and the shoulders, the pain is often more due to trigger points rather than the tender points. But in terms of massage, the issue in treating trigger points is that, you need to treat them with limited intensity, so not quite as much pressure, and also a limited duration. You don't want to be, sometimes, for example, in a sports massage, I could work on, one shoulder, for a good sort of 10-15 minutes without any problem. But in someone with fibromyalgia, you would want to limit the time so that you don't actually worsen their pain and other symptoms. So the tender points actually differ from the trigger points because they actually purely cause localized pain. There's no referred pain with the fibro tender points. So in terms of overcoming pain and sensitivity in fibromyalgia tender points, there's sort of various ways of doing that. So certainly we want a first massage, as I say, it would be very light. Even for a Swedish, sometimes it could be very light because of the sensitivity to pressure. So you would gradually, build up from a very light pressure on trigger points, to a light massage or something like manual lymphatic drainage, which can be quite effective. And so by gradually building up, it just reduces, again, the risk of a flare-up. Acupuncture has also been shown to be quite beneficial. You can also, if you're planning to go for a course of massage, what you can do, or even as a way to just deal with tender point pain and sort of build up your tolerance, you can actually sort of do a self-treatment at home by, when you have a shower or bath, just use a bath brush over those trigger points, just again starting with a light pressure, and then you just gradually over time build it up, and that will help sort of desensitize you to the pain a little bit. Stretching, as always, can help, again, just with the sort of condition of the muscles and trying to reduce joint pain, and correcting any underlying factors. So if there's a medical condition, for example, that potentially is linked, just making sure that you try and stay on top of that with medication or whatever the treatment may be. As I say, in terms of having a massage, I have witnessed therapists, unfortunately, who weren't knowledgeable about fibromyalgia, performing like a deep tissue massage at a time when actually the weather had just turned really, really cold. So that person was actually at risk of a flare-up anyway. A deep tissue massage, at any time was inappropriate, and certainly taken into account, obviously, the change in temperature. So this is where it is really important. Again, I say it all the time, just to make sure that you're seeing a therapist who is very qualified, who is knowledgeable about your condition, and, who will do an appropriate massage with appropriate pressure, appropriate techniques, and basically ask the right questions. But, as long as you do that, there's no reason why you can't have a massage at all. And certainly a lot of my fibro clients have actually found it really beneficial. Obviously it's not a long term, it's not some kind of miracle cure, but, by doing it regularly, you can really help to minimize the symptoms and minimize the flare-ups. And the outlook, really depends on how severe your fibromyalgia is. because fibro is usually a long-term chronic problem. But in some cases it can be quite mild. It can be life-altering. So, learning how to cope with the symptoms and finding treatments, whether it be massage or something else, in order to sort of just help you sort of manage your life on a daily basis is really essential. So I would say, give it a go, but make sure you do explain all how it affects you to a massage therapist. As I say, make sure they are qualified and they have experience in dealing with it. And yeah, hopefully, it will work with, for you. And I'd also say, if you are going to have a course of massage treatments, you're going to do it regularly. Also make sure that, you see the same therapist as well, because they will come to know exactly how your fibro affects you and sort of recognize any changes. So that they can then again give you the best treatment, to suit you. So that is all from me on fibromyalgia. As always, feel free to comment down below, subscribe to my channel, and you'll be notified of other videos that come out. You can always contact me through Facebook and Instagram, which I believe there is a link on this page, and I'll do my best to answer any queries that you have. But for now, that's all from me. So I will see you next time. Okay, bye.